Across America, a fleet of volunteer pilots donate their time and airplanes to fly sick patients who live hundreds of miles away from their closest hospital or treatment option. These missions of mercy are called angel flights. Arash Gadisha reports from California.
Good morning, Van Nuys.
The sun is not quite up at Southern California's Van Nuys Airport, but Mark Wolper is already into his pre-flight checklist.
We are putting in our flight plan now for Oakland.
Mark is an entertainment executive most days, but this morning he's a volunteer pilot for Angel Flight West.
We're going to need a run-up 1 Bravo X-ray.
A charity that flies sick patients who live far from the medical care they need right to their doctor's appointment and then back home.
Airspeed's alive. Flaps up. Good departure.
Pilots donate their planes, time, and fuel, so Angel flights are free for patients.
Oh, what a fantastic way to start the day.
Mark has flown over 200 Angel flights. He loves this route, 350 miles over mountains and farmland along the California coast. But he's found that flying patients to medical care makes the view from up here all the more beautiful.
It provides you with an actual mission, something to accomplish. You're giving back to the community and helping somebody out in need, and you're getting to fly all at the same time. Can't beat that.
These flights are not always easy.
Sometimes when you're picking them up after medical treatment, they're not feeling well, they're tired. Sorry, I get emotional sometimes when I talk about it. Sometimes you get kids who are really excited about flying, and their pain and suffering kind of goes away for a little while because they're so excited to be in an airplane and they want to touch it and feel it and they want to know what you're doing and they want to sit up front next to you. And they feel great. So you never know. They may feel good, they may feel badly, but they're always appreciative, and certainly deep down inside you know that they need it. You know, who knows what we're going to run into today.
Down through the clouds to Oakland to meet Roberta Ventura.
Nice to meet you.
8 years ago, Roberta was diagnosed with a type of tumor known to metastasize into lung cancer.
They said that it was inoperable. It wasn't a type of surgery that was wanted to be done, and so really there wasn't anything.
Except for one option, a clinical trial in Los Angeles testing a drug meant to treat osteoporosis, but found to have properties that could affect Roberta's tumor. For a moment, Roberta thought she lived too far away to be a candidate for the drug trial. And then
This other doctor who was hearing our conversation just kind of popped in with this name and number, and it was like a miracle.
that number got her here, to Angel Flight West in Santa Monica. Angel Flight West draws on a network of 1,400 volunteer pilots to get sick patients to medical care, but they say they're only able to meet a small fraction of the need. Roberta's flight this day is one of 4,000 organized each year by a team of staff and volunteers led by Josh Olson.
Well, it's a huge difference. Transportation is the biggest barrier to healthcare after cost. And if you can't access the healthcare you need, often you can't get well, or you can't have the hope and healing that takes place with trying to get well.
Angel Flight patients say they even find the actual flights to be therapeutic.
You get literally above the clouds and you're able to sleep or think or pray or meditate or whatever the case might be. We have patients tell us all the time that the actual flight itself is part of their healing process.
For Roberta, these flights are life-saving.
This treatment stopped the growth of the tumor, so I can't imagine what it would have been like if it had gotten bigger.
And for Mark,
how was that for you?
That was good.
they are life-changing. Arash Gadisha, Channel News Asia, Los Angeles.